What if I told you that one of the simplest, cheapest, most overlooked ways to support your sexual health after 60 is as close as your kitchen sink? You see, most men think it's normal for everything to slow down with age. The late night bathroom trips, the weaker response in the bedroom, the dry mouth, the sluggish energy, the sense that you're not quite the man you used to be. But what if I told you that how you drink water, yes, just plain water, can help you feel more alive, more responsive, even more like yourself in bed? Hi, I'm Dr. Edward. I spent over 35 years as a urologist and men's health specialist here in Greenville, South Carolina. Even though I'm retired now, I still see older friends and neighbors quietly struggling with the same things my patients did. And I want to tell you something, it doesn't have to be that way. I'm not promising miracles, but I am promising that if you understand the power of something as basic as water, you can unlock a level of health, energy, and yes, sexual confidence that most men give up on far too soon. Before we dive in, if you appreciate no-nonsense, practical health advice designed for men over 60, subscribe and tap the bell so you don't miss the rest of this series. And if you're here with me, let me know in the comments by typing 1. Why hydration matters more after 60. I used to ask my patients this simple question. How much water are you actually drinking every day? The answer was almost always the same. Probably not enough, document. Dehydration is a quiet thief. After 60, your sense of thirst declines. Your kidneys work differently. Medications for blood pressure or heart disease often pull extra water out of your system. Even mild dehydration can lead to lower blood volume and poorer circulation, dry, less elastic skin, increased risk of urinary infections, constipation, fatigue, and foggy thinking. And yes, difficulty achieving and maintaining an erection. One man I worked with, named Gerald, he was 69, retired teacher, told me, "Doc, I don't get it. I'm taking the blue pill, but it's not working as well." He was drinking about 3 cups of coffee a day, a soda with lunch, and a glass of wine at dinner, but almost no water. What water does for your erection? Here's what most men don't realize. An erection is a circulatory event. It's all about blood flow. Your body needs to pump blood into the small, delicate vessels in your penis. If you're even mildly dehydrated, your blood gets thicker. Your heart has to work harder. Your blood pressure can fluctuate in ways that reduce responsiveness. Your body diverts water away from non-essential functions like sexual response to keep vital organs going. In other words, if you're not hydrated, your penis is last in line. It's not about magic. It's about biology. Water helps maintain blood volume. It keeps your vessels more elastic. It supports nitric oxide production, which relaxes and opens vessels, critical for erection. I tell my patients, if you want better circulation down there, you need to think about what's flowing through your whole body. Why timing matters. Most men think, I'll just drink a big glass of water before bed. Bad idea. Why? It almost guarantees you'll wake up for bathroom trips. Interrupted sleep messes with testosterone production. Nighttime urination can become an ingrained habit. Instead, you want to drink water throughout the day. Here's what I used to recommend. White heavy checkmark morning. 1 full glass as soon as you wake up. Overnight, you lose water through breathing and urination. Replacing it first thing supports blood pressure and kidney function. White heavy checkmark mid-morning. Another glass with or without a snack. White heavy checkmark lunch. A glass of water before the meal. This also supports digestion and prevents overeating. White heavy checkmark mid-afternoon. Another glass. Many men feel a slump here. Often it's dehydration, not just fatigue. White heavy checkmark dinner. 1 glass. White heavy checkmark evening. Sip as needed but go light. How much is enough? I used to say there's no magic number. It depends on your size, activity level, medications, and climate. But as a rule of thumb, 6 to 8 cups, around 1.5 to 2 liters, a day is a solid target for most older men. Coffee and tea count, but watch the caffeine. Alcohol doesn't count. It actually steals water from your body. Gerald? Once he committed to regular water intake, he noticed something after a few weeks. Doc, I don't know what happened, but I feel like things woke up. He wasn't taking more meds. He wasn't doing anything else differently. He was simply hydrating consistently. Patient story, Walter. Let me tell you about Walter, 72. He was embarrassed to bring this up. He said, "Doc, I'm having trouble getting started in the bedroom. I feel dry slow, just not me." He also mentioned headaches and constipation. When I asked about water, he sheepishly admitted, "I hate drinking water. Always have." We started with small goals. 1 glass in the morning, another at lunch, another in the afternoon. After 2 months, my wife says I'm back to my old self. I don't get the headaches. Bathroom is easier. And we're closer again. It wasn't magic. It was hydration. A word about urinary health. I want to be clear here. Proper hydration isn't just about erections. It's critical for preventing urinary tract infections, UTIs, flushing bacteria from the bladder, diluting urine so it doesn't irritate the urethra, supporting prostate health, less irritation. A man over 60 with a big prostate who's dehydrated is just asking for trouble. Thick, concentrated urine can burn, make urgency worse, and increase infection risk. Hydration helps keep your urinary system moving smoothly, like oil in an engine. Gentle encouragement. Look, I'm not here to sell you on hype. Drinking water won't make you 25 again. It won't turn you into a porn star, but it will help you get the best performance your body is capable of at your age. Because at 60, 70, or 80, the key to staying sexually active isn't magic. It's caring for your body consistently, intelligently, and with dignity. If you found this helpful, subscribe and tap the bell so you don't miss part 2. And let me know in the comments, do you think you're drinking enough water? Most men don't realize there's a direct line between the glass of water you drink during the day and how you sleep at night, or how you feel when you stand up from your favorite chair and have to rush to the bathroom, or how confident you feel lying next to your partner, wondering if you'll have to jump up and pee before you can even get started. Hi again, I'm Dr. Edward. If you're just joining us, I spent over 35 years as a urologist in Greenville, South Carolina, helping men over 60 manage real, practical health issues. Today, I want to talk about prostate comfort, nighttime urination, and how drinking water the right way can reduce those embarrassing or annoying trips to the bathroom. Because it's not just about your heart or your circulation. It's about your sense of dignity, your freedom, your confidence as a man. The prostate problem most men face after 60. Let's start with something I've seen more times than I can count. A man in his 60s, 70s, even early 80s comes in and says, "Doc, I'm getting up 3 or 4 times a night to pee. It's driving me crazy." Or, "I feel like I can't empty completely. I stand there and dribble. It's embarrassing." Or, "I can't even think about intimacy because I'm worried I'll need to pee halfway through." Sound familiar? Most of the time, the culprit is a benign enlarged prostate, benign prostatic hyperplasia or BPH. It's so common, it's practically normal after 60. The prostate grows and presses against the urethra, the tube you pee through. That narrows the path, making it harder to start, keep going, and fully empty. Result? Frequent urges, weak stream, dribbling, nighttime trips that ruin your sleep. Why hydration matters. Now here's where most men get it wrong. They think, I'll just drink less water so I don't have to pee as much. It seems logical, but it backfires. When you don't drink enough, white heavy checkmark your urine becomes darker and more concentrated. White heavy checkmark, it irritates the lining of your bladder. White heavy check mark, it triggers more urgency and frequency. White heavy check mark, your bladder tries to push that hot, concentrated urine out faster, even when it's not full. Think about it like this. Concentrated urine is like pouring acid on your bladder wall. Your body says, get out now. That's why men who try to cut back on water often end up needing to go more. The nighttime trap. Here's another trap. Many men say, Doc, I chug water at dinner to make up for not drinking during the day. What does that do? White heavy check mark floods the bladder in the evening. White heavy check mark increases urine production overnight. White heavy check mark wakes you up at 1 or 2 or 3 in the morning. White heavy check mark ruins sleep quality. And poor sleep has consequences. Reduces testosterone production. Most of it happens during deep sleep. Increases stress hormones like cortisol. Weakens immune function. Leaves you foggy, grumpy, and unmotivated to even try for intimacy. So let's get this clear. It's not about drinking less. It's about drinking smarter. How to drink water the right way. Here's what I use to teach my patients. White heavy check mark 1. Spread your water intake over the entire day. Don't save it all for dinner. Don't gulp it all at once. White heavy check mark 2. Prioritize hydration in the morning and early afternoon. That's when your body needs it most, and you'll have time to process it before bed. White heavy check mark 3. Taper in the evening. Have sips with dinner, but avoid large glasses 2 to 3 hours before bed. White heavy check mark 4. Watch caffeine and alcohol. They're diuretics. They increase urine production. They also irritate the bladder lining, especially in older men. White heavy check mark 5. Don't skip water to avoid bathroom trips. It will backfire. A simple sample hydration plan. Here's a plan I shared with one of my patients, Charles, 75. He was getting up 4 times a night. Miserable. This is how we change things. White heavy check mark 7 to 8 a.m. 1 full glass of water when waking. White heavy check mark 9 to 10 a.m. Another glass. White heavy check mark 11 to 12 noon. Glass with or before lunch. White heavy check mark 2 to 3 p.m. Another glass or 2. White heavy check mark 5 to 6 p.m. Small glass with dinner. White heavy check mark after 7 p.m. Just sips if thirsty, no big gulps. After a month, he went from 4 trips at night to 1. His wife thanked me more than he did. Patient story, Henry. Let me tell you about Henry, 68. He was embarrassed to admit he was leaking, not soaking his pants, but enough that he felt humiliated at church or when visiting friends. He tried pads, but hated them. Turns out he was drinking almost no water all day. Then at dinner he downed 2 big glasses plus sweet tea. I explained, Henry, your bladder hates surprises. It wants a steady flow of mild, dilute urine, not a tsunami at 7 p.m. We spaced his water evenly. Cut back late caffeine. He said 2 months later, Doc, I feel like I got control back. He didn't need meds. He needed consistency. The link to sexual health. You might be thinking, okay, document, but what does this have to do with my penis? Everything. White heavy check mark if you're up all night. You're sleep deprived. That kills testosterone production. White heavy check mark if you're rushing to the bathroom all day. You're stressed. Stress increases cortisol, which blocks nitric oxide, the chemical your body uses to create an erection. White heavy check mark if your bladder is irritated, your pelvic floor muscles tense up. That tension can interfere with erection quality and orgasm comfort. White heavy check mark if your prostate is inflamed or congested. You can get discomfort during sex, less semen volume, and even pain with ejaculation. Bottom line, proper hydration reduces bladder irritation, promotes prostate health, supports sleep, and helps your body produce the hormones and blood flow you need for intimacy. A word about prostate health. I want to be clear. Hydration won't cure an enlarged prostate. It won't replace medical treatment if you need it. but it's a foundational step you can do every day to make symptoms better. It also reduces your risk of white heavy checkmark urinary tract infections, white heavy checkmark bladder stones, white heavy checkmark chronic irritation that can worsen BPH symptoms. I used to tell my patients, your prostate isn't your enemy. It just needs respect. Drinking water correctly is part of that respect. Gentle encouragement. Listen, I know it can feel silly to think something as ordinary as water matters so much. But in 35 plus years of practice, I saw men try everything under the sun: pills, pumps, injections, surgeries, while ignoring the basics. Your body wants to work. It's designed to, but it needs you to give it the environment to succeed. Drinking water the right way is one of the simplest, cheapest, most effective things you can do to support your sexual health, your urinary comfort, and your dignity as a man. If you're finding this series helpful, please subscribe and tap the bell so you don't miss the next part. And leave me a comment. How many times are you getting up at night? Do you think it's related to your hydration?